Quality Improvement for Surgical Teams, or QIST Anaemia Collaborative, is bringing together 30 NHS trusts from across England to work together to improve the quality of care given to patients having hip or knee replacement surgery. The QIST Anaemia Collaborative focuses on screening for and treating mild anaemia preoperatively. This has been shown to reduce the risk of blood transfusion, critical care admissions, length of stay and emergency readmissions. This is beneficial to patients as well as saving trust money.
In terms of the teams, over these 3 learning events, we're teaching them quite a lot about quality improvement skills. They will hopefully leave the collaborative not only having transformed this pathway in their own trust, but also hopefully hungry for more interventions in the future, so it becomes easier to introduce change.
We're in a specialist orthopaedic hospital, so we felt it was definitely something we should be involved with. I think it's a great project, anything that's looking to improve quality of care for patients. We would see patients preoperatively quite a short time before they actually had their operation, although they were listed for surgery many months before. So one big change we're going to make is taking blood tests when the patient's actually listed for surgery. So we've got a lot more time to sort out any problems with their anaemia. The idea is that we improve patients' post-operative journey. They have a shorter length of stay, they have a reduced number of complications, reduced number of transfusions. So hopefully it'll be improving things for our patients.
So I think our challenges were and still are getting engagement from pre-op. When our patients get listed for surgery, they obviously get seen in pre-op and are given a very thorough assessment, but it seems to be slightly random what happens to the patients if they are anemic, and I thought this would be a really good way of actually driving through proper standardised protocols.
This will give us a bit more focus. So I think in terms of joint replacement, it will get more priority within the trust for all the valuable things that can be done to improve matters. But the teamwork is a key thing, and identifying who does what and supporting each other is a key objective.
I'm the UK national lead for rapid recovery programmes for hip and knee replacements, and it seems to be a series of small changes that together add up to a very large thing. So, hemoglobin optimisation and the second part of the study, the screening for Staph aureus methicillin sensitive, is the next series of changes. We want infection rates low, complication rates low, outcomes high. Lots of collaborative trusts are going through the same problems together, learning from each other, and there's a structure with past performance and past results that we can follow. And there's funding. And so on so many levels, it makes it an easier sell to my trust, and therefore a greater chance of success and a greater chance of patients doing better.
We were hoping to understand a little bit more about how we can measure what we're doing, what impact it's going to have on our patients, and a bit of networking around the process, and if we can speak to other trusts about how they feel about implementing the process.
So after the initial 18-month Anaemia Collaborative project, the trusts involved in this will then embark on a second collaborative programme which aims to reduce surgical site infections by screening for and decolonising patients for Staphylococcus, a common bug that causes prosthetic joint infections.
MSSA screening is something that we're not doing at the moment, so obviously that's the latter part of the collaborative. That aspect of the collaborative in the project was something that was a real draw for us and something we really want to take forward.
My one wish is really that not a single patient has to suffer the consequences of not managing their anaemia preoperatively. It's been proven to show there's an increased risk of stroke, increases your length of stay, you're more likely to be readmitted after your surgery. There's also higher risk of blood transfusion and risk of being admitted to critical care. None of these things are pleasant for patients, never mind that they're costly for trusts. I think if we can improve these things just for one patient, that's fantastic, but really it's going to be a much larger group that we help by working together in this way.